And on this day each year, World AIDS Day, this is people worldwide unite in the fight against HIV and show their support for people living with HIV and commemorate people who have died. This year's theme is Hands Up for HIV Prevention. The campaign looks at ways to improve prevention strategies, especially for people who are vulnerable to transmission, adolescent girls and young women in particular. In a report released recently, UNAIDS says 18.2 million people are now on antiretroviral therapy. However, women between 15 and 24 years of age are at great risk of infection. An estimated 34 million people have the HIV virus globally. More than 35 million people have died of the disease since it was first identified in 1984. Over the years, scientific advances have improved prevention, treatment, and living with the virus. But many agree more remains to be done. Now joining us live via Skype from Baltimore, Maryland is Dr. Chris Beyrer, Desmond M. Tutu Professor of Public Health and Human Rights, Associate Director of Johns Hopkins University Center for AIDS Research, and President of the International AIDS Society. Dr. Beyrer, welcome to the show.
Thank you, Linord. It's wonderful to be here.
So this year's World AIDS Day looks at prevention, especially with adolescent girls and women. What is your take on the impact of HIV among this particular group?
Well, this is one of the groups that we're the most concerned about, particularly, of course, in Africa, and particularly in southern and eastern Africa, which are the parts of the world where we see predominance, the majority of new infections in adolescent girls and young women. The rates are really very high. South Africa, just as an example, about 1,000 new infections a day still. So we're very concerned about this group, and the good news is that we really do have some new prevention approaches with evidence for efficacy. So there's a lot of reason to be optimistic this year.
So we have reasons to be optimistic, but it is really a reason for concern when we see the rate among young people. Could complacency become the new HIV crisis? I mean, the sense that giving progress, perhaps young women and men are not so worried about HIV that much anymore and do not make the appropriate steps for prevention.
Well, that is a real concern. And one of the things that we're most excited about is that the very good evidence that treatment, effective early treatment of HIV infection, reduces a person's risk of being infectious, of onward transmission. But when we look, for example, at men in their 20s and 30s, we see that a very significant proportion of those men living with HIV are not tested and are not treated. And so because of that, that is bad for their health, but it also means that they continue to be able to spread the virus. So if we want to reduce new infections in women and girls, we really also have to do a much better job of engaging men in HIV testing and treatment. And we have to be smarter about that. We have to reach men where they are, in workplaces, in hours that are convenient for working men, and we have to reach them with things that they're interested in too. So there's very good data, for example, from Kenya and Tanzania that shows if you add screening for hypertension and diabetes, you get a much better buy-in of men agreeing to HIV testing. That's the kind of out-of-the-box thinking that we're going to need to really make a change in this epidemic.
Let's talk about R&D real quick, research and development. You were co-chair for this year's International AIDS Conference, a gathering where many experts present their work and research. What would you say are some of the latest top breakthroughs in HIV/AIDS research?
Well, I did have the honor of co-chairing the International AIDS Conference in Durban with my friend and colleague, Professor Olive Shisana from South Africa. I think certainly one of the big advances was the data from the HIV vaccine trials, that was HVTN 100, that looked at the immune responses in Africans and showed that they were really very vigorous. That data, which was presented in Durban, led to the decision to go ahead with starting the next efficacy trial, the big phase 3 trial of a new HIV vaccine. That started just a few days ago in South Africa. That's HVTN 702. It's a partnership with the U.S. and South Africa. And very importantly, I think that study is going to look at men and women with heterosexual exposure, over 5,000 of them, with a vaccine that is very much developed based on the subtype of HIV which is circulating in southern Africa. That's the clade C virus. So that's very important as an advance.
Okay, great. Thank you so much, Professor Beyrer. We like to end on the note of hope. We thank you for joining us today.
Thank you very much.
And that was Professor Chris Beyrer. He is Associate Director of Johns Hopkins University Center for AIDS Research.